Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it. Hey everybody, Crystal Stokes here, and joining me today is Dr. Kathryn Miller, who is a rural mixed animal veterinarian practicing in Kansas. And she believes that veterinary medicine is not lost and is excited to be a part of the change, which is what we are going to be talking about today. So Dr. Miller, thanks so much for being on.
My pleasure. I'm really excited to be here.
Awesome. Well, I thought we could dig in first to some of your early history. And, like many people in vet med, there is a part of your history that led to burnout. And I think that was very much a learning point for you. So can you talk about your early experiences and what led to that point of burnout?
Absolutely. I don't know why we all think we're going to be exempt, right? We're the exception to the rule. Not me. Everybody else in the field, but not me. And that was definitely me.
Not it.
Yeah. I don't know why we all think we're going to be different, but for me, I was, practicing heavily. And then about 4 years ago, I had got pregnant and had my daughter, and it was the most wonderful thing that had ever happened. But that is definitely where I had a line in the sand of, I feel it. I am most definitely burnt out. And I think I had probably been in that to some extent before, but now there was this whole new part of me that I needed to make time for. And that's when burnout caught up with me. It was there and it was present. And I was like, oh no, I'm not prepared.
Oh, yeah. And I think that experience is so common. I think that's why framing this conversation just right off the bat of, some people do feel like veterinary medicine is lost. They feel like, I don't know how to be in this profession and be well. I have to leave the profession. We see people looking to human medicine, looking to other industries and professions in order to have some sense of well-being again. So I think it's really an authentic place to start, very much relatable. And I think highlighting that we tend to go in thinking it's not going to happen to us. And without strategies, it probably will, especially when you add in something like children, which is like a whole other job on top of a full-time job.
Yeah, absolutely. Absolutely. Yeah, you bring up a great point that I don't think anyone will argue that veterinary medicine struggles with mental well-being, but I just refuse to accept that that's just the way it is. Veterinarians struggle there. No, what can we do about this? What can I do about this? And that's just something I'm really passionate about right now.
Right. So let's go there. When it comes to helping, what do you think is needed? And what are you doing in your practice?
Yeah. So we have built a lot of culture systems in our practice. I just posted about this on our social media the other day where we try to be super active. And that was a topic that came up. We had gotten a lot of questions about it. And I was visiting with someone and they said something to the effect of well, it seems like you have culture just really figured out at Rocking KM. I'm like, oh my goodness, no. But I think just recognizing that our team are humans and that they desire a healthy workplace, and just knowing that it's important and continuing to focus on it is something that we work at. And it's a constant work in progress, right? There is no finish line. It's not like, oh, we've mastered culture, but that is something in the clinic that we put a large amount of emphasis on. That is kind of the clinic structure of that. And then on a personal level, I've actually delved into a little bit of veterinary medicine coaching as well. So that's been something that was laid on my heart recently. And I was like, yeah, I think I have some value to add for people here. So I'm really excited to get that off the ground and rolling.
That's wonderful. And that's going to be a lot of what we discussed today. So you mentioned culture and how I always like to say it's like a garden. You have to tend to it forever. If you let the garden go, it becomes farrow. And then
Yeah.
at the wild jungle. So you have that aspect, and it looks like veterinary coaching has been a really important part of having that really healthy garden culture. So let's spend a lot of time there now. So for those listening, framing this up, we say veterinary medicine is not lost. One of the keys in terms of what Dr. Miller is going to share today is how this coaching aspect can be a huge aspect of kind of like reviving veterinary medicine. So let's talk more about that. How about when it comes to veterinary coaching, who is that target audience that you like to focus on?
Yeah. So right now, I feel like I can add the most value to young practitioners, kind of the first years 1 through 5 in practice. When I was in their situation, how about that? When I was in their situation, I came out ready to conquer the world, right? I'm a doctor now. I have all this clinical knowledge, but I had zilch, nada, none as far as mental well-being, how to navigate these situations. I mean, I don't honestly recall it ever even being touched on in veterinary school. I think that maybe they've improved on that some, but also, I mean, it's not a focus. How about that? It's not a focus. So when I kind of built out my coaching program, I was like, I didn't have this when I was at their stage in the career. So that's who I'm building this program for. I first got professional coaching for myself very near that time that I had my daughter. I think shortly prior to, but it really resonated when I hit burnout. And it helped me. I honestly, I can wholeheartedly say if I hadn't gotten professional coaching when I did, I would not be practicing veterinary medicine.
Can you say
I would be
about that? Like paint the picture a bit?
Absolutely. I mean, I was a new mom, and that was the most wonderful thing I had ever experienced. And it was where I wanted to be. And I think that I previously thought that I either have to be a veterinarian or a mom or a professional or, whatever. And it was a whole mindset shift around veterinary medicine doesn't have to be all of me. I can be a really wonderful veterinarian and a wonderful mom and a leader and a teammate, all the things. It doesn't have to be all of it. And if I hadn't gotten that coaching at that time, there would be a whole slew of people in Kansas that wouldn't have veterinary care. They wouldn't, because I was not prepared to battle that on my own. No doubt.
You would have gone towards being a full-time mom and letting veterinary medicine go.
Yeah, I really think I would have. Or maybe it would have, looked something different that I pursued another career path. I know when I was a young veterinarian, I heard of female veterinarians doing that, especially female after they had a child, right? That's why I said female. And I remember thinking at the time, oh man, they did that professional career, did all that schooling. How can they just let it go? And I get it now, friends. I'm sorry I said that. I get it. But yes, I feel that.
Yeah. I think that's so relatable again, because we don't have, I'll speak for myself. Those of us who are attracted to veterinary medicine may tend to be black or white thinkers, all or nothing, A or B, right. Binary, zeros and one.
Yeah.
That there's a whole slew of options in the middle, and we can kind of rediscover ways to blend different parts of ourselves. It doesn't have to be just a veterinarian or just a mother, but it's challenging to figure out what that looks like. And for people that have gone through like an educational system where there are right and wrong answers, okay?
Yeah, right. Yeah.
I'll think it in terms of gray is really, really hard. And I think that is one of the benefits of coaching, is it expands our ways of thinking, our perspectives on things. It gives us tools to help us manage the difficult emotions, the physical exhaustion, all of that. The burden we feel also being caregivers of like, we have to be responsible for everything all the time. So that's another archetype in veterinary medicine, is the helper, the giver, hard to receive care back. So all these things can be addressed in coaching. And I thought it'd be nice if we could kind of talk about, since you do the early career vets, that's really an area that you're passionate about. Could you talk more about some of the traps that you see early career vets falling into, in addition to motherhood? Like the transition of motherhood while still maintaining a practice was one thing we just talked about. What else do you see?
Yeah. So, early traps that I have seen young veterinarians fall into, it kind of leans actually into what you were just saying. I'm one of my clients right now. I really am passionate about Enneagrams, and we're working through some things. And she is Enneagram 1. So, for those of you that are familiar, Enneagram 1s often have a really harsh inner critic, and I can just feel her. I mean, she's a high achiever and got through vet school, doing all the things, and this inner critic is just eating her up. So I think just self-talk of where I was heading with that of being what you said earlier of the black and white thinker. I think that inner critic is really giving her that. She gave the example the other day as she was palpating a cow, and it took longer than she wanted it to. Okay. And she came to the right conclusion. The cow was open, but her critic was telling her, whoa, you hesitated there. Why did it take you a little bit longer? Are you not qualified? And so it's just reframing our mindset of she's always going to have, we don't want to change her, right? Like that is her, that critic. Something what we're working on is reframing the voice that has of maybe it's your assistant or maybe it's your mind coach or something, but reframing the verbiage that little person on your shoulder gives you of like, hey, you slowed down, you really palpated that cow, how to navigate that situation specifically, and work through it. I totally rabbit holed on you. We were talking about traps, but
that's a great one. That was a good, because who listening has not been there? And
right.
I love that you mentioned the Enneagram. For those listening who are like, what the hell was that you just said? The Enneagram is a personality typing system. Like you may have heard of Myers-Briggs or DISC or the Big Five. Enneagram is just one more. And it happens to be my favorite. I know you and I connected on that. You and I both share the same personality type, which is also really fun. We're like, yeah. And the one you just mentioned is called the perfectionist. So that we just said, like in veterinary medicine, we have quite a few ones. They are attracted to medicine. They like doing things the right way. They're very responsible people. And with each of the Enneagram types, what's really wonderful in a clinic, I love having the whole team typed, even like your top 3 types to say, one is my highest, but I also have a lot of 2 and a lot of 5. Those are good to know because that means you have the helper and then you have like this nerdy investigator part. Knowing those sides of ourselves can really help other team members help us because they might know, oh, your inner critic is probably really giving you a hard time today or, struggling with like, doing it the right way and then getting bogged down in it. So it's like a wonderful coaching modality. And I think it's so fun that you have that with your team.
Absolutely. Absolutely. Yeah. That came up on a meeting just earlier today. I was meeting with a teammate and I said, we were talking about something. I said, I haven't circled back to that yet. I really want to give that some deep thought and really just make sure I'm navigating that correctly. And she said, that's your wing 9 coming out. I was like, what? Don't you use my tools back on me?
I know, right? You're like, I'm mediating and seeing all sides of every.
Yes, right.
Yeah. It's so fun because you have the language. The beauty of the Enneagram, for those who are interested in it, when I bring it into teams, I say it's a way of creating a shared language and really bringing much more compassion into your team. You will start to have heart for each other like you've never felt before. And I've never experienced that with any of the other personality typing systems. Like I've worked with DISC, I've worked with Myers-Briggs, and it doesn't have the same impact on the team. So I can't say enough about the Enneagram. Like I'm really sold on it. I'm like a big fan.
Yeah, no, same. It completely reframed. I mean, that's why I asked my coaching clients to take it too, is like, if I didn't know that about her, I feel like that really helps me understand of right now, she does see the world in black and white, right? Like how you leaned into it. And that's just not true. Like, there's all these shades of gray that we're going to work through and figure out what fits you best. But we definitely think that way. A large quantity of us think that way. So
right, we do. All right, so let's pick back up on common challenges or traps that early career vets fall into.
Mm-hmm. Yeah. Another one that we talked about the other day too. I take a lot of these. I get a lot of direct messages on my Instagram, which is awesome because it helps me kind of really feel where that audience is at now, because it was 15 years ago when I was there, and I I feel it, but also it's easy to forget things, right? And something that they have hit on lately is really kind of identity loss right after school. The universe put that back on me the other day of my husband and I were book shopping, and I'm a book hoarder now. I love to read, but that was not me right after school. I don't think I cracked open a book for fun, if you will, for probably, I don't know, 5, 6, 7, 8 years. Just because I was so recovering and mentally unstable, honestly, just from that schooling experience and figuring out who I was anymore. Just navigating that again and remembering like I in fact can read for fun and I do enjoy it. I think that identity loss looks different for everyone. That was just a very specific example that was in my universe most recently.
Oh, I think that's so, I actually never heard somebody say it that way before, but it really lands that when you go through vet school, they often say, well, it's like drinking from the fire hose. So
Right. Yeah.
literally, in order to get through it, have to kind of whittle your personality down and just get through those 4+ years. And in that, you often will set aside your passions, the things that brought you joy, creative pursuits, things that interest you, or just like cut off. Also, when you're reading all these textbooks for school, your appetite for reading goes way down. Like, you're full. And it's so true that like trying to rediscover like who you are authentically outside of your identity as a veterinarian once you're in the clinic. I think that's a great example of a common trap.
Yeah, I am. I really enjoy posting and working through content on social media, and that one specifically got me thinking. And I was like, I've never seen it written down. It wasn't in my professional curriculum that I signed off on somewhere that I had to abandon who I was in vet school. That's not written down. Was that self-imposed? Did we do that as a large, cohort of humans that are in this professional schooling said, you know what, I'm abandoning all the other things I enjoy and I'm just a veterinarian now. I think for me, I felt it more because schooling, not felt it more, how it resonated with me is because schooling is so intense that I had no choice but to abandon some of the other things. And then when I got out and I was done with school, I'm like, well, I guess I actually don't know what I enjoy anymore. I had to re-find it. So that identity loss was something that I've, a trap that I think it's been in my face lately. I've seen a lot of it.
So interesting. Are there any other traps that you want to highlight today?
Oh, I think another big one too that I kind of spoke to earlier was just that I like a lot in the field are I enjoy my work. I enjoy what I'm doing, but I tend to think again that I would be the exception to the rule that exhaustion and burnout won't catch up. We kind of really already talked about that, but it has a price and it will find you. So having the tools to know how to handle that when you get there is so important.
It reminds me of that thing when people say there are two kinds of like motorcycle ride drivers, and it's like those who have crashed and those who will soon, or something like to that effect. I think that can be said in veterinary med. Like there are two kinds of veterinary people: those who are burned out and those who will be burned out soon. This is just human biology, right? Yeah. Our physical bodies and our mental landscape, psychological landscape, can handle a certain amount of volume. And what we tend to do in veterinary medicine is very high volume. Mm-hmm. And if we have not learned techniques to work with that, it's kind of like, you will see that with animals, right? Input, output, it's going to lead to certain disease processes, for instance. Mm-hmm. So I do think that it'd be really cool if we started including this in veterinary curriculums and as well as like med school for humans too. Because when I was training to become a therapist, burnout's also high in that realm. I can totally see that. Yeah, you work with trauma and it's very intense, and then the hours can be very long and you have a lot of like administrative duties afterwards and all that. So, but they build into our curriculum. You have to learn your own self-care practices. You have to go to therapy while you're in school to be a therapist. Like that stuff is like required because they want you to have longevity in your career. So I do think it's short-sighted that we don't have that built in. I'm sure there are a lot of reasons why, and I'm not the person to speak to that. But I love that you're bringing it in that if you're working with early career vets, you do want to have that on your radar of how you're coaching them to be prepared, normalize it, and then get through it.
Yeah. Yeah, absolutely. Yeah. Like you, I'm like, I don't know the answer here. Okay. I'm not saying every veterinary school should implement X, Y, and Z. I don't know. But it was kind of one of those things of my husband has often a point of like calling me out a little bit about it. And I was doing a lot of like saying, man, I just don't feel right about this. I feel like, these young veterinarians are going through all these things we previously discussed. And he's like, well, Katie, I mean, are you going to just keep, being frustrated and complaining about this state, or are you going to start to be a part of the solution? I'm like, damn it.
Wow, well done. I like that question, especially posed to your Enneagram type. Like you can't say no to a big challenge.
Right. Yeah, exactly. I was like, was that a challenge? Fine. Done. Yeah.
Love that so much. All right. So let's talk a little bit more about how with new veterinarians, like, okay, they're coming into the world and they're starting to vet options, like looking at potential career opportunities. Can you talk to them about like what you work with them on coaching, like red flags and green flags?
Absolutely. Yeah. I was thinking about this earlier, and I'm kind of circling back to coaching just a little bit, but the reason I feel like I have a really powerful relationship with my coach is I enjoy her as a human and our values align, and I can talk to her on a professional level, on a personal level. It's just someone I want to be around. And I think sometimes we walk into these, practices and we go, oh, this is a great practice and this pay is great, XYZ. But do you feel the culture? Can you talk to this person? Do they speak to you with transparency and respect? I think I am Enneagram 8, and I very much think with my gut. And when I'm in those situations of I'm communicating with someone, like this feels good to me. I feel this. I can ask this person this. And I think just really, honestly, I'm perhaps a very simple thinker, but how does it feel to you? Can you ask them questions? And I'm not saying like, I say the word transparency. I don't mean like, are they giving you all their financials and XYZ? But I just mean, can you really speak to them candidly? Does it feel good? That's honestly a very simple piece of advice, but I just think just really trying to feel the culture and what it feels like for them is really pretty gosh dang valuable.
So simple, but really profound. So the green flag would be when you're hanging out at that clinic, you feel at ease. You feel like you can ask questions because you're new. You're going to have a lot of questions like, hey, I don't know what I'm doing. Or I think I just made a medical error. I think I just sent that pet out with the wrong medication, the wrong dosage. Oopsie. Do you feel safe to be your true self, to speak up and ask questions, to have that open dialogue and communication? Or red flag, do you feel like you're walking on eggshells, holding back, shrinking yourself down? That sense of lack of safety. I don't know. Because it's really hard to grow in an environment like that, especially early career. Got to ask a lot of questions. You're going to make a lot of mistakes. That's how we learn.
Absolutely. And just, in that of like feeling comfortable with the environment, right? And feeling comfortable, just like you said, to ask the questions, and feeling comfortable with saying like, hey, I don't feel comfortable with this situation, and learning to navigate that, I think is, there's so many things as a new practitioner, right? Like there's so many things. You don't even know how to work the practice management software. Like how do I even turn this computer on, right? And just, feeling safe there. And I don't want to make light of when I have a new associate, I have high expectations. This doesn't mean I'm going to take it super easy on you. No, I need you to meet these goals. You're a part of our team, but it's my job to provide you the structure and the teamwork and the team and the mentorship to make it happen. Right?
Yeah. Yeah. Let's talk a little more about that. Let's say you're working with an early career vet. They've been in a new practice for maybe 3, 4, 5 months. and they're struggling with issues around like workflow and mentorship. He's just maybe talk a little bit more about that, how you work with them on it.
Workflow. Tell me, elaborate a little more where your head's at. I like.
Well, yeah, let's say they come in, they say, I want to weave in like the whole team, right? Teamwork aspect too. From a workflow standpoint, I feel like I really don't jive well with the technicians. I feel like they're looking at me and judging me that I don't know what I'm doing. They're kind of babysitting me. I'm seeking mentorship, but I'm having a hard time because the veterinarian I'm supposed to get mentorship from is so busy since our shift's still online. And so we have all these plans for mentorship, but it's kind of clunky. It's not really happening. And I want to talk to my mentor about these workflow issues, like I'm trying to get through the day, but I'm holding back all the time with my tech team because I just don't really feel comfortable. I don't think they really trust me. Like, do you have issues like that come in?
Mm-hmm. Yeah, sure. I think team flow is, again, I think I used the word transparency earlier. It's one of my favorite words of just, we mentioned Enneagrams earlier, and understanding how we all communicate is different. I have some new people on my team right now. I am an 8. I am super direct. And I think sometimes I'm aggressive might be the right word. So just working through that with your team and being, fully transparent there of like, after I have worked with someone and I feel like I maybe have been a little bit over aggressive, saying, hey, I just want you to know that is my personality style. I will communicate directly with you. So circling back to where you were at is perhaps, having that atmosphere where you can, your tech can talk to, or their veterinarian can talk to their tech and say, maybe the veterinarian's an 8, or perhaps they're a 9. How about that? They're a peacemaker and the technician is an 8. And that might feel like a little different, right? Because maybe the technician is going, hey, you need to get over there to exam 2 because we have XYZ, and the doctor almost feels threatened or something. So I think that just having clear communication and having the framework to work through that is really valuable. I had another point there. What was it? I lost it.
I know that happens to me all the time.
It was really great, but I lost it. It's gone.
At 3 a.m, you'll remember it.
Yeah.
Yeah. I can see how. I'm just trying to help people who've never done coaching imagine this. Imagine if you were in that situation, right? You're that veterinarian who's a little more reserved, likes to hang back and just see the whole situation, keep the peace. And then you have a tech who's really direct. That's like, hey, you need to get over there. And you're like, ah. And then you're thinking, I want to talk to my mentor about this, but they're busy. If you had a coach on your side, you could bring that to your coach. That coach can work with you just like you were, start reframing like what was actually happening and help you figure out in your lane what changes could you make, because we can't change other people necessarily. Yeah. We can't change the reality that schedule's kind of a hot mess and you might not get optimal mentorship, but we can still work on your side of the street. And I think what you shared was, just a helpful reframe.
Yeah. Coaching is one of like, I like to, with my clients, try and clarify the difference between coaching and consultation, right? Like coaching is allowing me to give you the tools that you need to navigate this situation this time, the next time, and the next time. And that doesn't mean like after we're done with coaching, you're fixed, you're healed, you're ready to go. But it gives you the tools to figure out what you need to do. Consultation is a little bit more like, here's what you need to do in this situation. And I'm not going to say that sometimes we need both hats, right? But I really strive to be a coach and not as much of a consultation advisor. So
yeah. Thank you for highlighting that. We always do that too. We say, this is therapy, this is consulting, this is coaching. They're 3 very different things. And so knowing what you're doing, I think is helpful to frame that, what kind of conversation you're going to have. I know we also touched on supporting moms earlier. Is there anything else you want to add to that? I want to circle back because I know it's so many veterinarians are women, and so they might also become mothers. So do you want to add any more for options for moms? If you feel like we already covered it, then we can just skip past that and they can snip this part out.
I'm trying to remember. I saw that on our notes and I don't remember precisely. Did we have a point earlier that we wanted to highlight and I can't remember what it was.
Yeah, I wonder if there's anything that you would just recommend, like, hey, if you're a mom, an early stage vet, is there anything there that you feel is important for them to consider options within that their career as they're adding in a family?
Yeah.
Because I think we did touch on it pretty thoroughly. We were like, hey, I had to learn that I'm not just a vet or just a mom.
Yeah, I can't think of anything other than super logistical that maybe doesn't feel as relevant. I'm sorry if I had a point last time and I've lost it.
I don't know. I don't remember either.
Okay, good. Because I'm like,
I'll tee you up for the next one then. Now that. All right. So one more really important aspect that I remember we talked about this, I got very excited about, is the importance of mindset.
Mm-hmm.
Yeah. Things are going to be hard. That's part of medicine. So can you speak to that?
Yes. Mindset. Mindset is one of the most powerful tools that I have in my toolbox. And, I was thinking about this the other day. I posted about it the other day, and someone made the comment, which internet troll, trust me, it did not get to me. I was like, do they have a point? And they said something about being just overly optimistic, and like that I wholeheartedly disagree. Mindset is a choice of, we can't change what's coming at us, but we can wholeheartedly choose how we interpret it. Veterinary medicine is hard. You are going to have long days. You are going to lose patients. There are going to be culture issues. There are going to be team issues. It's all those things. But just learning how to reframe your mind about that is without a doubt, one of the most powerful tools that all of us already have access to. You have all the tools. You just have to figure out how to make it work for you. And there's not a one size fit all. It's not what works for me, and mindset might not work for you. That's why it's glorious. It's one of those shades of gray, right? Like, how does that work for you? It is a extremely powerful tool.
Wonderful. As you were saying that, it reminds me of something from, so I'm a marriage and family therapist, is the type of license that I hold. And we often talk about, it's not about trying to find the perfect partner or the perfect marriage. Just like you don't have the perfect career where everything's going to be good and you're going to feel happy all the time and it's easy. Those are not targets to aim for. It's not reality. And instead we say, you're looking for the type of partner that comes with the type of issues that you think you can live with long term. Mm-hmm. It's like picking a pet. It's the same way. Like, okay, I am going to pick a dog. I cannot accept a dog that is very loud and barks a lot, but I could accept a dog that occasionally chews something up, you know? So you know that life's going to come with a set of challenges. You understand the veterinary medicine. We have euthanasia. We have medical errors. We have things that die for no reason. We have angry clients. You know, we have short staffing, all the things. We work with biological beings and humans. It's going to be messy. It's like, if you have that mindset, you're not expecting it to be like roses and unicorns and rainbows. Yeah, it definitely helps us cope with the reality, right?
Right, absolutely. And I think especially as a young professional, again, that audience that I just really feel resonated to help lead, it's so powerful right then, because they are going to have a lot of challenges, point blank. It's going to be a little bit tough in the beginning, but just learning how to, navigate, like, there is no finish line, and learning how to feel comfortable in the uncomfortableness that's around them and say, I really did good at this case today, and I want to learn how to do that skill of it better. Okay, I'm not saying that means you have it mastered and I nailed it and there's no room for improvement, because that's not true either. But just learning that feeling uncomfortable is okay. It's okay.
That's a great remedy for anxiety too. So for those people listening that might feel kind of anxious, what Dr. Miller is saying here is like leaning into that discomfort to then grow more comfortable can really help with anxiety. So I think Dr. Miller, you're making such good points. And as we come down the home stretch today, we have talked through so many like meaty topics. We could have probably done 4 different podcasts, honestly, if you want to dive into them. For those people listening, if they're anything like me, they might only take 1 or 2 things away from a podcast. So if that audience out there that's listening to us today, what do you hope they take away from today?
My hope is that they, if they feel they are in the right spot, or even better, if they feel like they have everything, kind of lined out right now, would be to just explore some coaching options. There's a lot of really wonderful options out there. I can't even begin to explain how much it has empowered me. Through all the things that we just discussed, through mindset, through learning culture, through learning teamwork, through learning Enneagrams, how much it has empowered me, one, personally, professionally, as a leader, as a coach, all those things, to just explore that a little bit if you're unfamiliar with it. And speaking specifically to those newer graduates, really that last point, I think that was a real game changer for me. When I'm working on something new, especially like coaching, that's a relatively new adventure for me. It's okay to not have all the answers. None of us do. But just to feel like, passionate about what you're doing, and knowing that I am okay with the uncomfortableness around me, and I'm growing every day in it.
So well said. I really have enjoyed this conversation. And for those listening, I want to encourage you, reach out to Dr. Miller if you like this style of direct conversation and energy. You're all over social media. I can link up everything in the show notes. If people do want to reach out, what's the best way for them to reach you?
Yeah, they can check out our website. There's contact us links on there. And also, I am super active on social media. They can DM me there and I will respond. So
I love that. Okay, all of it will be in the show notes. And Dr. Miller, I really appreciate you being on today.
My absolute pleasure. Thank you so much.
You're welcome.
Bye.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.